Hi, I'm Dr. Jason Dulac coming to you from my office in Springfield, Virginia. At my office, a lot of patients ask us about snoring and sleep apnea, and I'm here to answer some of those questions for you today. What is sleep apnea? Sleep apnea or obstructive sleep apnea is the tongue collapsing against the back of the throat and closing the throat for 10 seconds or more, 5 or more times per hour. So snoring is the tongue flapping against the back of the throat. Sleep apnea is when the tongue closes over the throat and stops the flow of air and stops your ability to breathe for 10 seconds or more. And the diagnosis of mild sleep apnea starts at 10 seconds or more, 5 or more times per hour. Who is at risk for sleep apnea? About a third of patients who have sleep apnea are of normal weight and build. So you typically think of a heavier set guy, like myself, being at high risk for snoring and obstructive sleep apnea. But about a third of the patients are of normal weight. If you're snoring, I always recommend getting tested for sleep apnea. You can do home sleep tests with your doctor, or we have some in the office for you. We currently do them at cost of $299. That includes a sleep study read by a board-certified sleep specialist in the state of Virginia. So you can get a diagnosis of if you have sleep apnea, and if you do, we can go over some ways to treat it. There are dental appliances that are made for snoring and sleep apnea. They work better for mild to moderate sleep apnea than they do for severe sleep apnea. For severe sleep apnea, you always want to try a CPAP first. But a lot of patients can't tolerate a CPAP. They're hard to travel with, they're uncomfortable, but a lot of patients do like them. So for severe sleep apnea, we always recommend trying CPAP first. They also have other options for sleep apnea currently, like the Inspire. It's a kind of a nerve stimulator, stimulates the throat, keeps it open. But all the dental appliances do is they hold the lower jaw forward so that the tongue cannot collapse against the back of the throat. So you can even do this yourself. So if you, I snore, so I can do it. If you lean back and go, you can kind of feel that. If you lean back, but then you move your lower jaw forward, you can feel how much more airflow comes through there and how the tongue can't collapse against the back of the throat. So the base of the tongue is attached to the lower jaw. By holding the lower jaw forward, that opens up the airway and prevents sleep apnea. How does sleep apnea affect your health? It's tied to pretty much every bad condition that you don't want. Cancer, diabetes, heart disease, stroke, all that stuff. When you hear of somebody passing sleep gracefully in their sleep, what happened is they couldn't breathe, they had a stroke, and they died. So not breathing is not comfortable, and you're just not aware of it because you're asleep. It's also associated with a lot of accidents, daytime sleepiness, a lot of issues like that. What happens a lot, though, is when we're short on sleep, our cortisol levels come up. So we don't really know that we're tired. We do have some sleep screening questionnaires here in the office that'll help assess your risk, but the best way is just a sleep study. So if you have a sleeping partner and you hear that sleeping partner snoring, I definitely recommend a sleep study. Check with your doctor, but we also have them here at the office. They're $299. It's just a little watch, like a little Apple Watch type thing with a pulse ox and a chest lead. And that will allow you to get quite a bit of information about how you sleep, when you snore, when you're on your side, what side you roll to, things like this, how many apneic events you're getting per hour. If you have mild, moderate, or severe sleep apnea, the dental appliance would be a good option for you. Dental appliances are a great option for snoring for everyone. So anyone who snores is a good candidate for a dental appliance. Also, anyone with mild to moderate sleep apnea is a good candidate. There is a high correlation of grinding and sleep apnea. Fortunately, the dental appliances that we make for snoring and sleep apnea act as both a night guard to protect the teeth from clenching and grinding and relieve the stress on the joint, and also open up the airway for sleep apnea. So at our office, we have a health questionnaire for all patients. On that questionnaire, we do have some screening questions for snoring and sleep apnea for you and your sleeping partner. So that's one way that we screen for sleep apnea at our office. I do an airway screening for all of our patients at every exam. These are some ways that we help screen and identify. We also have some screening questionnaires. You can go online to find these as well. The Epworth Sleepiness Scale is a good one, or the Stop Bang questionnaire are two of the most common ones. Those are two that we use for all of our sleep patients. These are just screening questionnaires. They just help identify your risk of sleep apnea. The only way to diagnose sleep apnea is with a sleeps test, home sleep study, or at a facility. There are advantages and disadvantages to each. I prefer the home sleep test because you're sleeping in your natural environment. If your copay is more than $300 with your medical insurance, let us know. We do have home sleep tests for $299. What are some treatment options for snoring and sleep apnea? Well, you have dental appliance, which holds the lower jaw forward to open up the airway. We have a CPAP, the mask that pushes pressure in to keep the airway open. Or now they also have a surgical procedure, the Inspire. It's almost like there's a little lead that goes in the chest, much like a pacemaker keeps your heart on track. You kind of activate this with like a little key fob before you go to bed at night. There's a little lead that goes to the throat and stimulates the throat. So there also are surgeries that can be done to open up the airway surgically. These are a good option for some patients if there's certain obstructions, large tonsils, adenoids. Those are the primary reasons to undergo surgery to open up the airway. Inspire is a newer option, good for a lot of patients. Then there's the CPAP, and then there's the dental appliance. So some advantages of the dental appliance: it's one of the cheaper ones. It's more portable. It's easy to use. It also helps with grinding of the teeth as well. Can surgery help me heal sleep apnea? There are some surgical options to open the airway, mainly for the removal of tonsils and adenoids, and also the Inspire device where there's that lead that goes to the throat to open the airway. What appliances do dentists recommend for snoring and sleep apnea? They're all mandibular advancement appliances. One of my favorite is the Panthera. It's very thin, medical grade nylon. It's one of the strongest and least intrusive devices. Tap appliance has been around for a while. Somnomed is a common one. So there are a lot of different appliances out there, but most of them work by moving the lower jaw or tongue forward to open up the airway. If you're concerned with snoring or sleep apnea, or your dentist doesn't treat snoring or sleep apnea, give us a call. I'm happy to do a consultation for you at the office. Our office number is 703-451-4500. I'm happy to go over the dental appliances with you in more detail. Also, more information can be found on our website, which is dulacdds.com. I have some of the common appliances that I like, the Panthera, and also the WatchPad, our in-office medical screening tool that we work with the board certified sleep specialist on to see if you have sleep apnea. But just give us a call if you have any questions about this or would like to set up a consultation today. Thank you, and I look forward to seeing you in the office soon.